England's poorest communities were hit by a perfect storm of wage, housing and test and trace issues that led to high coronavirus rates, leaked government analysis report. The report by the Joint Biosecurity Centre, JBC, concluded people in poorer areas were less likely to self-isolate due to being unable to afford losing. This study also found that in Blackburn-with-Darwen and Leicester, areas badly affected by the pandemic, more people had been rejected than accepted when they sought financial help to self-isolate, increasing the likelihood they could not follow self-isolation. The JBC, which was established in May last year, aims to provide evidence-based, objective analysis to inform official decision-making over COVID-19 outbreaks. According to The Guardian, the report last month marked official sensitive, said interconnected factors such as deprivation, poor housing and work conditions, and test and trace system delays were likely to be significant contributors to high corona. Researchers looked at 6 months' worth of data from the COVID-hit areas of Blackburn-with-Darwen, Bradford and Leicester and compared it against 3 other areas with similar socioeconomic issues but lower coronavirus case rate. Areas with a higher proportion of people employed in public-facing roles, for example taxi drivers or supermarket workers, were likely to see high infection rate. The study reportedly said, having high numbers of people in high-risk occupation is not specific to just these. This in isolation is not a reason for enduring transmission, but rather along with a range of other factors, overlaid, that create the perfect. It also said that existing socioeconomic inequality had left Black, Asian and minority ethnic, Bame, communities more exposed to coronavirus due to living in cramped, multigenerational housing in deprived areas and working in public-facing. The Guardian said the JBC report also raised criticisms of the NHS Test and Trace program, which Boris Johnson originally promised would be world-beating but as it said anecdotal insight pointed to locally led contact tracing being more responsive and more effective due to an understanding of local communities' needs. Contact tracing data was also not given to local authorities quickly enough to contain outbreaks, the study said, with delays in the sharing of data affecting their ability to contain virus. The report said there was no silver bullet to resolve the issue of ongoing coronavirus transmission, with it likely being down to a combination of linked factors including deprivation, employment and household. A government spokesperson said, "We do not comment on leaks. We recognize this is an incredibly difficult time for many people and we launched the Test and Trace support payment to help people who cannot work from home to self-isolate. We are working with England's 314 local authorities to monitor the effectiveness of the scheme, including any impact on groups who may be ineligible. Local and national contact tracing teams are working in lockstep with NHS Test and Trace to break chains of transmission, and their efforts are paying off, with over 8 million people contacted and told to isolate by the 300 local contact tracing partnerships in operation.